think we haven't done anything like this for West Hampshire CCG. We don't have the conversation around digital very often, and it's not a component part of our everyday work. People aren't having those conversations, so we really needed to take some time out and understand what it means to everybody, explore the concepts so we can introduce all of this kind of stuff into our strategy as guiding principles, as a work programme, to ensure that what we're doing with technology is aligned to clinical needs, staff needs, patient needs, and to bring that together into kind of a holistic picture and really hear it from all of our staff.
I think it's important to come together like this as an organisation to discuss something as innovative and I suppose in some ways cutting edge as digital, because I think we're on the cusp of a very important digital age in terms of healthcare. We can see that in a lot of other parts of our lives, online and shopping and with banking and things like that. And now more and more we're realising the power of digital.
So I think with everything that we do in CCGs, in terms of commissioning services that we commission, it's important to think, first of all, is there a digital aspect to this that I should be thinking about? So is there a digital point of entry for a patient? Are there systems that need to be in place for the people working in that system? And then to ask, actually, is there already something out there that people are doing locally? So quite often there will already be systems in place that people can take advantage of, and that helps us to get maximum use of current investments.
Ultimately, if you make it straightforward and if you make it easy and if you make it work, people will use those tools. We've seen that with banking. Many of us now use online banking and the tools work well. So we need to get the tools working, we need to make them available, and we then need to change the way we work to adapt to that new model of working.
Well, and I think when you look at things like Google and Facebook, they've never had to really go out and advertise. They've grown their user base just through having really good tools that are simple to use and easy to use and actually give people something that they need. And that's, I think, how we need to think about it from the user interface point of view. And particularly when professionals in the health and care system are so pressured, actually to make something simpler and easier for them to do, I think is really important. That needs to be our kind of driving force, I think.
We've got to be in a position where it's simple, and we've got to remove some of the complexities that they are and make sure that it's driven from clinicians, from patients, so that it is embedded, they're invested, they've designed the right things for them.